All crimes are really horrific, and sexual assault, though, is different than others. It really affects people in a different way, and it really hurts people in a very personal way. And I think that really I would feel badly if anyone ever was sexually assaulted and didn't come to the hospital and didn't seek help, because aside from the physical aspect, there's so much emotional damage that happens to people that we can help heal. And I think they should always come and, you know, pass the word on to their family members or acquaintances that this is available to them, and just come by.
We want our patients to feel comfortable, to feel safe, and we want them to know that they can come here for help if they need help.
I hope this never happens to anybody out there, but if it does, really you should feel safe in coming to our hospital or any hospital that has a safe examination program.
We have 18 examiners. We have examiners from Queen's Hospital. We have examiners from Elmhurst. And they take call 24 hours a day. And they cover holidays, weekends, nights, and days. And when a case comes in, they get contacted, and they have 1 hour to get here from the time that they're contacted from the emergency department. That victim gets placed in a private room in the emergency department with someone who's watching over them, like a PCA or a nurse, until the examiner gets there. And then the process starts once the examiner gets there.
So it's actually a team effort, though. I'm the examiner. I do the kind of the medical part, and then there's also a savvy advocate who's a volunteer who comes to offer emotional support and counseling and information. There's often a social worker involved, and then of course the police and the detectives, and then other medical staff.
So we're looking for DNA evidence mostly. So we take swabs, which are just regular Q-tips, and we swab them anywhere where we suspect there might be DNA evidence on the patient. Other kinds of evidence that we collect are we do photographs, and we also use something called a colposcope, which is like a magnifying camera that we use to find subtle injuries that might not be visible to the human eye. We can use that to find the injuries and to photograph them and document them in the chart.
I think initially when you come in, that's always the icebreaker. You have to come in, you introduce yourself, you tell them who you are, what you do, how the exam is going to be done. When they hear forensic examiner, they feel there's going to be police and there's going to be tapes and all those things, so they kind of get tight to giving you information. But if you explain the steps to them and what you're going to do, how you're going to do it, and the importance of the exam, I think they kind of relax and let you do the exam that you need to get done.
Some patients come in frightened, some patients come in very upset, some patients come in very closed off to the whole process and not really willing to talk about it. We get all different kinds of emotional states coming through those doors.
You definitely have to be sensitive in the matter, you have to be understanding, and you have to, you know, be very patient, because some people, they don't open up immediately. You know, you're asking a lot of personal, sensitive questions, and you have to really gain their trust first, and just that alone sometimes can take 45 minutes.
In the training, you are taught to explain to the patient that they are in control, okay, and they should be in control, okay. So I explained that not once, but I would say many times during the exam, you know. I'm explaining this now, but if there's anything that you don't understand, please ask and tell me. If there's anything that makes you uncomfortable, please let me know. If you don't want me to do something, if you want me to, I would probably explain it again because it's important. But if you don't want any part of this exam, please let me know. I will not do that.
You know, during the exam, we give the patient like ample time. You know, I ask if they need to take a break at any given time, understanding that some of the exam points and some of the questions that we ask can re-trigger the trauma that they've just gone through.
So yeah, a lot of patients come in and one of the first things they say is, I feel so embarrassed, I feel ashamed, I shouldn't have been in this place, or I shouldn't have been with that person. And I try and reassure them that it's absolutely not their fault. Nobody asked to be assaulted, especially sexually assaulted. It's a horrible crime, and there's nothing that they did to initiate this or to make somebody assault them. And you know, I try and assure them that it's not their fault, and they really shouldn't feel badly about themselves and feel ashamed or embarrassed, because that's the last thing that you would want somebody to walk away from, you know, a crime and then feel like it's their fault.
There's a lot of stigma for women, mostly women, but there are also men, to come forward and say, I was raped. There's a lot of shame put by society on that person who complains about it or who says somebody assaulted me. That, oh, maybe you did it yourself, or, you know, or you were asking for it. And here, at least now, the concept is not like that anymore. In this country, I mean, especially that I see in this program, that you actually try to understand from the victim's point of view what is going on and get the story as honestly as you can.
Hearing from from Glenda Guzman, who's the coordinator, telling you that, Catherine, such and such a patient, the person was arrested, they're now behind bars for 10, 20 years, so it makes you feel very good that you've had somebody out of the community and that the person that you helped is now healing and they're not fearful of that person coming back to them and, you know, assaulting them again.
You always hope that, of course, they're going to catch the person who assaulted them. And so that, I think, keeps me going. Just, you know, sometimes we get some feedback that somebody's been caught and they've actually been sent to jail, which is great. So I think even if that happens just a few times and you get a few people off the streets who are sexually assaulting people, that's very gratifying, and that keeps me going, I think.
I would hope that anyone in the community would feel safe coming in. Everything we do is totally confidential. Everything we do is optional. We don't force anyone to speak to law enforcement. We don't force any part of the exam or the treatment on anyone. And, you know, like I said, everything is optional, and that's made known to patients right from the start. So whether they're here just for medical treatment or just to be checked out and make sure that they don't have any injuries, or whether they want evidence collection but they're not interested in medical treatment, whatever part they're interested in and comfortable with is what we'll give them here. And I hope that people do know that and do feel comfortable coming if they need to.
As you know, we have a lot of patients who don't come to the hospital because they don't have insurance, they don't have money, and they're fearful about it. And this situation is a little different. We do provide that care for free for victims who don't have insurance, and we want to make sure that the community is aware of that they know that they can come in for help. They would never be denied any care.
Sexual assault forensics examiners, we're people just like you. I think for the most part we all try to put ourselves in that person's shoe. It's not like television, it's not like SVU per se. I think most of the people who do this, at least all the people that I know that does this, they truly care about the survivors. They care about the cases.
We have a great, compassionate team. They're very caring. They give a lot of time to this. They have a lot of energy, and they want to help everyone.